Hello, hi guys, welcome to Doc's Podcast. Dr. Aly here.
And Dr. Ingky, welcome to the
Happy New
Oh
Year.
yeah, it's New Year. Forgot already.
Yeah.
Yes, passes by. Nowadays, right, I don't really keep track of the
date.
of the day,
Date-
whether it's the
date
year or
and
new.
date, I don't know.
No lah, you know why not? It's just age lah.
I
I admit lah, due to age right lah. Just New Year.
Finally,
nothing much one.
the uncle talk is coming out from you.
Yeah.
For the longest time, it's always Aly's the old one, he's the young one. Now that he's feeling it,
Yeah, man.
over multiple reasons. If you want to know more, you scroll through the episode. Last few ones, he's already admitting the age.
Yeah,
already.
man. I'm really
Back
admitting the age,
pain,
back pain, neck
bedridden.
pain lah. Yeah, man. Do a little bit exercise like here, pain, there, pain, everywhere, pain.
Welcome to your 40s. Yeah, so anyway, we're at a podcast whereby we talk virtually about anything.
Yep.
So the way we do is one of us will come out with a topic, the other one, and we will talk to the other one as though the other one is
As if we are educating
one another. All right, this week's my turn. So with the start of New Year, I want to start something that is relevant to our doctors out there because we are also on Docuity.
Yep.
So it's a platform for all the doctors. So this year, when we start, I want to talk something related to doctors' profession.
Okay.
Not so much about how to get there, but what they do on a day-to-day basis. Because quite a lot of our audience are actually GPs also.
Oh,
Right?
interesting.
So I want to talk about, should doctors limit giving MCs?
Oh, this is interesting.
Huh.
Okay, now the question is, what do you mean limit giving MCs?
Now, you've been a GP before,
Yep.
right? I've been a GP before. We've done locums before.
Yep.
And how lenient are you in giving MCs?
Yeah, I'm usually quite strict in giving MCs.
Quite strict. What do you mean
Yeah.
by strict? Define strict. Be
Alright.
specific.
So when I say strict is when I find that there is insufficient evidence of severe illness, or I wouldn't say severe illness lah, but you are unable to carry out your work, then I would not give you MC. If I find that you are unable to carry your work, then I will definitely give you MC.
Alright.
But if it's for minor stuff, example, nothing pertaining to your work,
Okay.
then I would deny you the MC. Example, if you're coming for a toothache, right? If you're coming for toothache, if I do find that your gums are inflamed, I will give an MC because
Okay.
toothache can
Okay.
cause a little bit headache.
Alright.
But if you come for a toothache and I find that I can't really find any inflamed gums, but you are actually complaining about it, then I'll probably give you a little bit painkillers, offer you probably a
Alright.
little bit of injections. All right,
I don't want.
And if you don't want it, then I would say, you know what, since you don't want injection, maybe you're not that much of a pain.
Okay.
So I say you can go on with your day, no
Okay.
problem.
And apparently, the way you think is not wrong.
Yeah, it's not wrong.
It's not wrong because that's exactly how most doctors would assess their patient.
Yes, that's right.
And to the patient's disadvantage is they came to see, whether rightful or not rightful, but we are the ones who are judge, jury, and executor of the MCs for them. All
That
right.
should be the case.
Now, let me put it this to you: what if he's actually having depression? He needs a rest, otherwise he's suicidal, but he can't tell it to you that way.
Then that is different.
But you don't know.
Yeah,
He masked it with a toothache.
He could have masked it with toothache.
Now-
You are totally right.
Now, how would you respond to this? If now you know he's overworked or he's under stress, he's got some personal issues and he needs a day rest. But there's no symptoms to say that he's otherwise ill, apart from, let's say, mental exhaustion.
Then I would say, if you suspect mental exhaustion, I would say giving MC is just something like a band-aid for a very big wound, right? It's not going to help in the long run, right? It will definitely, of course, solve his anxiety of his depression issue for that one day. Right? It will not help him for the long run. If you do suspect that someone might be overstressed, right, or might be overworked, or have some sort of underlying psychiatric issues, then my advice will be then to talk to them,
All right.
right,
All right.
or to then talk to the employer, right, to see what is wrong,
All right.
whether there's a mismatch in workload, or whether there's a miscommunication between them. Because I feel if someone's having issues like this, and they are still continuously going to work, and you're giving MCs just to prevent them for that one day of work, it's not going to help them in the long run.
It's
right?
a temporary thing, right?
Yeah, it's a temporary thing. They'll keep coming back.
Okay.
Right.
Okay. And it's fair enough. Again, like I said, us being doctors, and I'm putting myself in the position of a GP when I was still there also. I agree with your assessment. I really agree with your assessment, provided we are able to detect that they have such an issue.
Yes, that's right.
All right. So provided we are able to detect, or we manage to pick up some signs, or the patient themselves were a little bit forthcoming. Okay, now I'm going to ask you one more question. What makes you want to limit, even if there was no physical symptom?
I would say limitation of medical cert is because a medical certificate is a doctor's assessment whether this person is fit or unfit to work. So if the doctor finds that this person is medically fit to work, then the person the person is denied the MC.
And if he says exhaustion, will you still allow?
If it says exhaustion and it really shows signs of exhaustion, then I'll probably be lenient and give a day off. Again, I will have a look at their track record, right? If let's say if they've been to the clinic multiple times, I'll be able to assess whether this person has been taking a lot of MCs in a short period of time. But if let's say the person is new, then I will probably have to take his word for it.
Okay. Again, whatever you say is absolutely right. It's the same kind of assessment that I would have done, and I'm sure a lot of our colleagues would have done. Now, I have consulted a HR consultant, and I actually asked, what is the doctor's role in giving MC? What's our prerogative? How's the HR's role in communicating with the doctors also? So today, let me share with you some of the findings that I have. By the way, this was asked by one of my friends from Right House Solution. Want to know? Go and type Google. Right House Solution. So, anyone who's in any basic employment, by labor law, starts with a minimum of 14 days of MC.
Yes.
And after 2 years of employment, you increase 2 days, 2 days, 2 days, up to the point whereby the employer can decide what is the maximum. I think 18, then from then on, it's up to the prerogative of the employer. When it comes to MCs, again, it's in a way, right? It is actually the patient's right to demand and ask. In a way.
Of course.
And it's up to us to actually assess and for us to execute and to give or not to give. So it's always to the best of the clinician's acumen, whether are they ill, have symptoms, then of course that's a straightforward thing. Not ill, whether they have any other form of stresses, or it is actually just something that is borderline. Nowadays people have a lot of these borderline issues whereby you are not really very ill, but you are at the brink of exhaustion. Not enough to show signs or symptoms of, lack of sleep, jitteriness, lack of focus. I would say those are actually nearing to the end of burnout, whereby they will collapse anytime because of the burnout.
Correct.
A lot of people now are actually a bit more well aware of themselves, and they know, I'm actually tired. Okay? And they can occur at any point of time. And they don't know where else to seek for help. Apart from, hey, can I
take a day off?
Exercise my employment rights. So it ends up to us doctors and our humanity of how we want to assess and to give. So after discussing with the HR consultant, what I infer and can share is that it's really up to us. It's really up to us whether we want to give or we don't want to give. We don't even need to have a valid reason.
That's true.
It's between us and the patient.
Yep.
Now, where does the employer and HR fall into? We have patient-doctor's confidentiality.
That's right.
So, in other words, right, the HR can never ask you as a doctor, is he truly sick?
Yes, that's right.
They can't. So, I think a lot of us are in a position whereby we're afraid. What if I give, and then this fellow go and post on Instagram that he's having a holiday? And then the employer will come and say, hey, you gave him an MC, but he's enjoying himself somewhere, looking very happy. At the end of the day, it's between the HR staff and the staff. Has he maxed out his 14 days or whatever days entitlement that he has? The HR can only call the clinic to only do verification. Of, are you a valid clinic? Did this employee of mine come, and was this MC given?
Yep.
That's it. They are not entitled, and they have no right to ask, is he truly sick? What is the diagnosis? And why is the MC given? So I think what I want to convey to doctors is, don't worry lah.
Just give the MC.
Just give the MC. At the end of the day, right? If he takes too much MC, it's not your problem.
It's true.
It's between him and HR. HR will then send him a letter. What's the HR going to do? Send you a letter and say, hey, you're not a very good doctor. No. At the point when he come, he has this complaint. And I cannot deny him. What if something happened to him? Do you want to take responsibility? Again, we are judge, jury, executor of this one single document. And maybe 90% are people who are seeking to take a day to relax. But what if that 10% person is actually at the brink of something big? And there's no other avenue for him to take a break apart from just trying his luck to exercise this so-called labor law right of his, which he has not exceeded, let's say. And if he exceeds, that's his problem. But if he has not exceeded and he needed the rest and we deny him, and that day he decided to snap, and the next day you read it on the news that this guy did something. Again, we might be too busy to read it also lah, but what if we did come across it? That burden that falls upon us, right? And saying, for me, I would be actually quite lenient. For me, as long in my record, you're not this frequent fella who comes and there's a pattern to you. Like, you're a Monday fella. Every Monday,
you're there.
They're there. Or every Sunday night, you're there for the Monday. Then there's a pattern. But if you're coming and it's twice a month or even 3 times a month, but on different days, right? I don't think I will ever deny. I mean, that's for me.
Interesting.
That's for me.
Now, when I used to run the GP clinic, I used to be quite strict with
MCs, right?
Yeah.
I used to be like that also.
Right.
When I started, right, I used to be very strict.
No, I wouldn't say I am super strict. When you do come with some sort of body pain, when you do arrive with some sort of very minor injuries, I will give you a day off, right? Even sometimes 2 days off, right? If I feel that you're ever need.
Fair enough.
But if let's say I can't find any physically wrong with you, all right, and if again, as you mentioned, if I realize that you're always coming on certain days to take MCs. Now, my right of denying you MC is nothing more than it's not denying you the rest, but I'm denying you as a patient. It means it is a message to say, hey, you know what? Probably it's better for you to seek your medical
this kind of thing somewhere else.
Right? In the future, it's a way for you to seek it somewhere else.
Yep.
But it's a kind way of saying, you know what? I will see you this time, but the next time when you come in, it's probably better if you see the clinic down the road. Alright. So that's my way of saying. That's my way of gently pushing them, nudging them outdoor, and hoping they don't come back again. But occasionally they actually do. Now, have you ever heard of HRs rejecting MCs?
Yes, I've heard of HR actually rejecting MC. Legally is wrong.
Legally is wrong, yes.
Legally is wrong.
Yeah, legally is wrong.
So for somehow HR people, or if your wife or your husband is in the HR department, legally is wrong.
Yep.
You can be taken to labor court.
Yes, that's right.
If the doctor has given an MC, unfortunately, that's also judge, jury, and executor lah.
Yes,
it is, and the employee has not finished up their entitlement.
Yep.
It is only after they finish the entitlement, you may reject based on your assessment.
Yes, that's right. That's right.
But within their entitlement, you're not allowed to reject because the doctor has actually given already.
Yes, okay. You are
so
totally right.
Presenting all this, there are some problems. I'm presenting my form of solution, which is I would give, and it's of course pending no identifiable pattern. I'm actually quite lenient. Dr. Ingky is less lenient, but he will find
But
a way.
I will find a ways to.
To-
I will still give you an MC if I think it is valid.
Yeah, but if it's frequent, he will try
frequent, I
to
would say,
carry you away to somewhere
yeah,
else.
yeah, sure,
I
move
think
away.
looking forward, doctors should also look into being able to identify and discussing with the HR. That part, I think there's nothing wrong. To
are
tell
right.
you the HR,
You're right.
some of your staff are having a higher frequency of MC. Perhaps you want to look into or do some form of counseling.
That's true.
Because the HR role is to actually counsel the
It's-
employees.
yeah. For them, they're actually supposed to look after
The welfare.
Yeah,
Correct,
the
the well-being.
welfare of
The well-being.
of-
So
of the
us as
staff.
doctors, we only look after when they are falling ill, or in this case, ill enough to need a rest day. But the HR needs to look apart from their work hours, their remuneration. It's also their well-being, which also falls under this. I think a lot of companies now, especially the larger ones, even have counseling services.
Yeah, actually, from what I've noticed is the more strict the HR, the more frequent the person comes for MC.
Oh, really?
Yeah, really.
Really, yeah.
Because there are a lot of MNCs these days. All right. Again, depends on the position that you're in. Now, if you're in an executive position, there are a lot of MNCs these days that allow you to take one day off of work. All right. If if let's say you do visit a clinic,
All right.
and even if you don't get an MC, right, a lot of the HR will say there is no need to present us the MC.
Okay.
Just take the day off.
Ah.
All right. A lot of MNCs are actually very lenient in that sense.
Yeah.
Because they understand
Yeah.
that if you feel that you cannot do the work that day, they're in no position to force you to work.
Correct. You're not effective for the company anyway.
You are not effective.
Yeah.
So from what I've noticed is when HRs are lenient, then the staffs don't actually fall ill that easily. And at the same time, they don't actually go seek for MCs just to take the day off. But usually when the HRs are strict, all right, and then they say without any proper excuse, you need to come to work, and they are the ones, their staffs are the ones who you regularly
Find a way to
find a
break
way
it,
to take a day off.
Yeah. So, for doctors out there, start 2024 with a new mindset. I know traditionally we are on this mindset of being very strict. There are many options for you to consider doctors giving MC. Whether do you want to allow, you don't allow, what's the frequency you want to allow. I think it's good to do an audit of yourself.
Yeah, that's right.
An audit of your practice, an audit of your processes, and see how else can you find solutions to a problem that is age-old. Age-old. We've been GPs more than 15 years plus.
Yeah, long time already.
And until today, it's still an issue.
It is still an issue.
Yeah. I mean, when we go on the group chat, right? People are still complaining about all this
About
X and X
MCs,
patients
yeah.
taking MC, frequency of MC. But we need to consider that at the end of the day, the HR is the one that actually manages their overall one. They overtake the MCs. That's the HR's job to monitor. Not really our problem so much. Okay. Hope you found this session interesting. It's quick, but I think informational use for us in the GP practice especially. And hope you have a wonderful 2024 ahead.
Yes.
See you then. Dr. Aly here, signing off on The Docs.
And Dr. Ingky, have a good weekend.
Have a good weekend.